We're up. Think we're okay now? Okay. All right. Good morning or afternoon, whatever it is getting to be. Today is Tuesday, December 23rd, 2025. It's now 10:24. We're here for a regular session of Hunt County Commissioners Court. At this time, I'll call the meeting to order and ask Commissioner Monroe to lead us in prayer, followed by the Pledge of Allegiance to our flags.
Heavenly Father, thank you for the gift of life, Lord, and for all the blessing that you bestowed upon us. Lord, I ask that you just help us today to conduct business with integrity, Lord, and Lord, just give us wisdom. Lord, I ask you to be with the first responders as they serve the community, Lord, and the men and women that serve the armed forces. Lord, we ask all this in your name. Amen.
Amen. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Honor the Texas flag. I pledge allegiance to thee, Texas, one state, under God, one and indivisible. Thank you, everyone. We have Commissioner Money, Commissioner Monroe, Commissioner Smith, Commissioner Harrison present. I'm Judge Stovall presiding over the meeting today. Commissioners, you have the minutes from December 5th, 2025 special session. Entertain a motion for approval.
So move.
Second.
Got a motion, second. All in favor say aye.
Aye.
All opposed? Motion carries. Commissioners, you have the minutes from December 9th, 2025 regular session. Entertain a motion to approve.
Motion.
Second.
Got a motion, second. All in favor say aye.
Aye.
All opposed? Motion carries. At this time, we have public testimony. Speakers are limited to 3 minutes and should conduct themselves in a civil manner. The Commissioners Court cannot take action on items not listed on the agenda in accordance with the Texas Open Meetings Act. Concerns will be addressed by county staff that may be placed on a future agenda or addressed by some other course of response. Anybody wish to speak today? Come forward, state your name and address, please, sir.
Hello, my name's Dalton Jones. I'm with the Quinlan Fire Department. My address is 2605 Marshall Lane, RC.
Is it mic on? It is, yeah. Okay.
All right.
Stand a little closer to it.
My bad.
There you go.
Do y'all care if I do another prayer?
No, that's fine.
All right. Dear Heavenly Father, thank you for this day. I just want to say thank you for letting us be a part of this court, Lord, and just living on in your glorious name, Lord. In Jesus' name we pray, amen.
Amen.
Well, I'm a volunteer with, as you can see, Quinlan Fire Department, and we're here for, I'm blinking. Crap. I'm blinking. I'm sorry.
You're fine. Anybody else wish to speak?
Good morning.
Good morning.
My name is Dylan Fowler. I'm a volunteer with the Quinlan Fire Department. As you can see, our chief is not here. He's fought hard enough and long enough. Now it's our turn to stand up and fight for him. I stand before you today along with my brothers and sisters in uniform to protest the defunding and closing of a crucial fire department to Hunt County and the community for which we serve. I also ask that you take a look at each and every person in the Quinlan uniform behind me, and ask that you take a look at the apparatus we have outside and know that we are here to make a statement to all of you and to the public which looks up to us. We are here to stand up for a family, a brotherhood, and a community that needs us, for we take pride in our department, our equipment, and most important overall, we take pride in serving our community. We ask that each and every one of you reconsider moving forward on defunding and closing down the department and destroying the family that we have and cherish amongst the Quinlan Fire Department. We risk our lives together not for financial compensation, but for the payment of being on the front line whenever we are called upon. We look out for one another, and we look out for those that we protect and serve as well as serve alongside. I personally have been a volunteer firefighter for over 6 years. I've been through several different departments. By far, the Quinlan Fire Department has been more of a family to me the last 2 years than any other department I've volunteered for. Please know and understand that defunding and closing the Quinlan Fire Department will not only hurt us as a family, but also the families that we're there to protect and serve. To some, we may be just another fire department, but to those we show up for when they need us most, we make a huge difference in their lives, and quite oftentimes, it's a difference of life and death. The citizens we serve make a change in our lives as well, for the looks on the faces of those that we have served in the past and those we will serve in the future will be forever imprinted on our minds. Those faces of fear, desperation, and sorrow is what keeps us driving forward. For the faces on the members of the community today may be the faces of us or someone that we love tomorrow. But for us, it's knowing that the community knows that someone is willing to show up when the public needs us is what keeps us doing what we do so willingly. So again, we all ask that each and every one of you reconsider the defunding and closing of a crucial department that has held the role of protecting and serving the communities and the families around us for over 60 years, might I add, the oldest the fire department in Hunt County. For we are and we always will be the Quinlan Fire Department. I thank you for your time and the opportunity to present this opposition to you.
Thank you, sir.
Thank you.
Kevin Kerb, 8450 County Road 2412 in Quinlan. Hello, my name is Kevin Kerb. I'm a captain and paramedic with the Quinlan Fire Department, and I started my journey on Quinlan Fire before I was even an EMT basic around 9 years ago. I have made brothers, sisters, and friends for life on this department. I come to y'all today to give you the facts and the impact you are making on this amazing family. Quinlan Fire Department is the only advanced life support department in South Hunt County. What that means is we can give albuterol to a child having an asthma attack or run a 12-lead EKG to determine if the patient is having a heart attack and then give the corresponding meds to help the patient. That means we can provide better care, aid, and treatment than any other department in South Hunt County when the ambulance has an extended ETA. We run an average of about 100 calls a month. Quinlan Fire currently has 31 members on a roster. 6 of those members are paramedics. 6 of those members are EMTs and 2 are fire certified. Several were previously fire certified, with several more in school for one of the 3 roles. If there are multiple departments on scene, we are the department asked to provide medical aid. We, the Quinlan Fire Department, understand that we did nothing to deserve what's about to happen to us, and that it's all political to save $60,000. We have met and exceeded every expectation that was asked of us. As a resident of Quinlan nearly my entire life, I know how much people are struggling to make ends meet. There is a very high chance that the ESD that South Hunt Fire is proposing will not pass, and when it doesn't, they will quickly realize that they can't maintain the extra district without the extra funding. We have been targeted for years during our weak points and periods of subpar leadership, but it has continued on even after rebuilding our membership and our leadership. They attempt to take more and more from us, the fake accounts that tarnish our reputation, the news articles that have been proven to be lies. There's no other way to put it, but we have been bullied by the surrounding departments, and the people that were in positions to help did nothing. Yes, as previously discussed in Friday's meeting, a few members did go to South Tawakoni Fire. They resigned from our department after an internal investigation started after they were found to be violating department bylaws. A huge thank you goes out to Union Valley Fire. They have shown us time and time again that there is still good in this county by the way they act and unwavering commitment to helping the people of this county. They are the only department that believes in us and supports us. With that being said, sometime in the future, after the defunding of Quinlan Fire will be shutting the station doors, and Union Valley Fire will be inheriting the Quinlan Fire Department's vehicles, gear, equipment, building, deed to the land, and the personnel. The radios that were going to go to Quinlan Fire should now be going towards Union Valley, their 6 extra vehicles, and their inherited personnel. Quinlan Fire's legacy will live on through them. I've been informed that y'all have already made up your minds about the vote, but I urge you to look at the facts and do what's best for the citizens of Hunt County. Thank you.
Thank you, sir. Anyone else? Being none, I'll close the public testimony. Daniel, was anybody online?
There's, one email comment. This came in on the public comments website. It's 3 single-space pages, so I'll stick to the same 3 minutes. This is from Rhonda Elaine McKeon. Dear Judge Stovall and Commissioners, this is my public comment for the December 23rd, 2025 Commissioners Court regular meeting. I'm writing this on behalf of the City of Hot Cove as its administrator, its police chief, and as a resident of Southern Hunt County to formally express my support for the Quinlan Volunteer Fire Department and to urge this court to maintain its contract and funding for the department. As the Commissioners Court considers the future of fire service in our county, I ask that you base your decisions on objective data and present present legal obligations and not act prematurely, that is, before a public vote determines future changes. In addition, the fact should be kept in mind that the recent closure of the Hunt County Regional Quinlan facility has left Southern Hunt County without those services, creating a greater need for diverse methods of obtaining emergency medical services, not for diminishing such sources. The QVFD was established in 1965 and has now been serving Hunt County residents for 60 years. That 60 years marks 100% volunteer-led fire protection and first response services. QVFD is historically recognized since the year 2000 as the first and still the only fire department in Southern Hunt County to provide advanced life support. QVFD has been a 501c3 organization since June 2008. First and foremost, the City of Hot Cove entered into a 10-year contract with QVFD in 2023. The agreement represents a continuing formal long-term commitment to the safety of Hot Cove residents. The QVFD has diligently and consistently improved its operations, maintaining a high and appropriate standard of service and care since 2021. This is what led the City of Hot Cove into its contract with the QVFD. This is the fire department that the city officially trusts and relies on. Wisdom recommends that the Commissioners Court carefully consider the legal and logistical consequences of dissolving such a department. Any move to defund or dissolve the QVFD may result in direct breach of service to the city, leaving a significant portion of our county's population without the protections they have contracted for and creating unnecessary legal and safety liabilities for our city residents, their homes, and Hunt County. I would support the court's decision to hire outside neutral consultants to review Southern Hunt County Fire Services, as this would finally provide a professional audit of the facts. Until such an independent review is complete, I ask that you continue to support men and women of the QVFD who risk and have risked their lives for our communities every day. I'm aware that the Caddo Mills area seeks transition to an emergency services district, which would create a paid full-time department staff. The ballot measure was delayed until November 2026. For Caddo Mills, it would represent a change to professionalization. All right, I will, this was emailed in. You'll all get a copy of this as well.
Okay, thank you. All right, I'll close the public testimony at this time. Commissioners, we'll move on to old business. We have none. New business under the consent calendar. Entertain a motion to approve the consent calendar.
Motion to approve.
Second.
Got a motion second. All in favor say aye. Aye. All opposed, motion carries. Approval of accounts payable.
Motion to approve payables.
Second.
Got a motion second. All in favor say aye.
Aye.
All opposed, motion carries. Approval of line item transfers.
Motion to approve line item transfers.
Second.
Got a motion second. All in favor say aye.
Aye.
All opposed? Motion carries. Approval of budget amendments.
Motion.
Second.
Got a motion second. All in favor say aye.
Aye.
All opposed? Motion carries. Commissioner, I'm going to move payroll and personnel until after we have executive session. Under number one, the Treasurer's Monthly Report, September 2025. Brittany?
Good morning.
Morning.
Hi.
Merry Christmas.
Yes, and y'all. Okay, I am here to present the Treasurer's Monthly Report for month end September 30th, 2025. Just for public note, it is kind of typical for September, October to come in a little bit later as we close our books for September over the Thanksgiving holiday. So by meeting, with meeting deadlines for the first court in December, I wasn't able to get those in. But yes, it's not like we were behind or anything was missing. It's just closing of the books for the end of the fiscal year. So for September 30, 2025, we had a month-end balance of cash and invested funds of $51,164,814.40. All bank statements were reconciled and the auditors and treasurer's books agree. Also, I wanted to make a note for the year-end September 30, 2025, that the taxpayer dollars earned a total of $1.2 million in interest earned over the fiscal year from October the 1st, 2024 to 9/30 of 2025. So we brought in a pretty good, decent amount of money with the money that we have invested. So like I said, we started the year around 4.5 to 4.75 on interest rates, into the year about 4.35, somewhere in there. So we're still hovering about that at the end of September. So that is the report for September 30, 2025.
Any questions? Entertain a motion for approval.
So move.
Second.
Got a motion second. All in favor say aye.
Aye.
All opposed? Motion carries. Action item number 2, the Treasury's Monthly Report for October 2025.
All right, and as we start the new budget year for the first month of our fiscal year for 25-26, we had a month-end balance of $48,459,572.43. Again, all bank reconciliations were balanced, and the treasurer's and auditor's books agree. Does anybody have any questions on October month-end? Okay.
All right, entertain a motion for approval.
So moved.
Second.
Got a motion second. All in favor say aye.
Aye.
All opposed? Motion carries. Thank you,
Thank you, sir.
Brittany. Action item number 3, to discuss and possibly take action on the approval to change the status of currently vacant position from a medical assistant back to a registered nursing position, and update on the 2025 activities of the health clinic. Carolyn?
Good morning, Judge.
Morning.
Good morning, Commissioners. I want to just say thank you for allowing me to come here today.
You
And
may
I
want
want
to
to
pull
wish
the mic down just a hair. There you go.
Okay. Is that better?
Yeah.
Okay. All right. So today I have come to discuss not a complete breakdown of what we do, but rather several core public health duties, including immunization clinics, communicable disease investigations, partnerships with employers to provide vaccinations, and guidance and support for our school nurses. These services work together to protect our community health and prevent the spread of disease. And I want to take this opportunity to invite each of you to come by and see us anytime. And you can see firsthand what we do, okay? So as the judge said, my name is Carolyn White, and I am the registered nurse and medical director of the, or medical manager rather, of the health department. And some of you I've seen before and some of you are new, so I just wanted to make sure you, I wanted to say hi and welcome to Commissioner's Court. So the purpose of our services is, as I said, disease prevention and protection of public health. And by ensuring access to vaccines, responding to communicable diseases, and supporting schools and workplaces, we help reduce illness, hospitalizations, and outbreaks across the community. Our immunization clinics play a key role in providing routine and recommended vaccines for people of all ages. Staff ensure vaccines are stored and handled properly, administered safely, and documented accurately. Education is also a critical component, as patients often have questions about vaccine schedules, safety, and effectiveness. And our immunization clinics also improve access by offering low-cost or no-cost vaccines to eligible individuals. Our outreach efforts may increase during flu season or outbreaks, and our staff work to address vaccine hesitancy by providing reliable, evidence-based information and answering concerns. Communicable disease investigations begin when a reportable disease is identified. Our clinical staff work closely with healthcare providers and laboratories to investigate cases, identify potential exposures, and monitor disease trends. Early detection is essential to preventing further spread. Based on findings from investigations, public health may recommend isolation, quarantine, treatment, or preventative medication. Education is provided for both cases and contacts to reduce transmission, and information is shared with state and federal partners to support broader surveillance efforts. Now, in your packet, I provided you with a few graphs, which are not my forte. I'm a nurse. I'm not a an IT or a graphic designer, but I wanted to share with you a few of the things in your packet. So if you will look on the graph that looks like this, the first graph has the 2025 communicable diseases is the title. So this year alone, just since January 1st until December the 2nd of 2025, my department has had over 530 communicable diseases that were reported to us. And that is just within Hunt County, okay? Some of those investigations, once they were investigated, they didn't meet case criteria for one reason or another. Maybe we discovered that they weren't residents of Hunt County. Maybe the improper testing was done, so they didn't meet that case criteria to be considered a case. But the point is that it still takes hours of our time to perform these investigations. We had a number of measles cases this year that we had to investigate, and there were 11 of them, in fact. And once, with a case such as measles, we're notified by the provider at the time of testing before we get results. We have to treat that person as if we assume that they do have measles. Okay, so we follow that person for several days, daily, until we get those lab results back, either confirming or that they are a case or that they aren't a case. Okay, so we had 11 individuals in 2025 alone. Okay, of those, within that same stream, we had 154 people that we had to follow for a number of days, for anywhere from 5 to 21 days, based upon their contact with someone that had had measles. And so what that involves is us contacting that person every day and going through a line list of symptoms. And if they develop symptoms, then we have to proceed on to the next step, which is investigating them as a case. Okay. So we had 154 individuals this year that we followed. And then we also had 2 respiratory outbreaks in nursing homes in the county in 2025. And so that is the kind of thing that with communicable diseases that our department does. Okay. So then We partner with companies to provide immunizations, helping to bring preventative care directly to employees. On-site clinics make vaccination more convenient and support occupational health goals. And these partnerships are especially valuable during flu season or public health emergencies. As you know, we set up at the courthouse for employees of the county. We also went to the sheriff's department to 2 different nights to try to get the deputies there immunized. Okay, that's another kind of thing that we do. So workplace immunization programs benefit both employers and employees by reducing absenteeism, lowering healthcare costs, improving overall workforce health. And employees appreciate the convenience and the community benefits from increased vaccination coverage. Our health department works closely with school nurses to support student health and safety. This includes guidance on immunization requirements, exemptions, and compliance. Public health also assists with decisions related to school exclusion and the return to school during illness. School nurses rely on public health as a trusted resource during communicable disease events. We provide consultation, educational materials, and ongoing communication to support disease reporting, outbreak response, and prevention strategies within schools. This year, we partnered with multiple school districts to provide 7 on-site back-to-school vaccine clinics. We spoke to high school seniors at 11 different schools about utilizing the state vaccine database to preserve their immunization records. Additionally, we held 19 days of back-to-school outreach events during the months of July and August, of which 6 were off-site. So when we do an off-site clinic, we literally have to pack up everything in our office, transport it to that site, set up, provide the clinic, tear it back down, take it back to the office. We did that 19 times. This just during July and August this year. There's another graph that I fixed for you. Looks like this. Okay, and I broke it down. I did a comparison from July 1st through September 1st, the number of patient visits that we had, comparing 2023, 2024, and 2025. So in 2025, during that 2-month period, we saw 477 kids or adults, combination. In 2024, we saw 535. In 2023, we saw 394. So you can see that with the exception last year, we had an increase, a dramatic increase over the previous year. We did fall back down a little bit from that number, which we noticed that we were not seeing as many immigrants that were new to the area. And so we attribute that to that decrease in number, okay? But it was still a large increase over 2023. So I also have there for you that from January 1st to December the 2nd in 2025, we had seen a total of 1,061 patient visits, and a total number of vaccines that were administered to them was 2,954 vaccines. So that's a lot of shots in arms that we do. And you may not know, but we are funded by a grant. It's called the Texas Vaccines for Children. And that is a grant provided by the state of Texas that provides vaccines to children who are eligible. Okay, so in 2024, we had received 3,474 doses of vaccines from them. And the cost of those vaccines was $285,897.13. So that was a value to our community that helped public safety, okay? Helped keep us all safe, and it didn't cost Hunt County a dime, okay?
At first, it didn't cost us.
Well, just
The
last
grant
year.
stayed the same for 20-something years.
Right. But these are vaccines
But the
that we
vaccines
didn't
have
have to, we
increased,
didn't
yeah,
have to
right.
purchase in order to protect our community. Right. And so, as the judge said, over the years, we've been getting this grant since the late 90s. And the dollar amount of that grant has not increased over the years. But of course, our overhead has increased. And so the grant money does not go as far as it once did. Okay. So, in addition, let's see here. In addition to the TVFC program, we also have the Adult Safety Net program, which also is provided by the state of Texas for adults that that need vaccines. And so if they are eligible, to be eligible for the ASN program, the only requirement is no health insurance. But it is a limited inventory of vaccines available through that. In addition to direct patient care, our team oversees the vaccine management of 13 Texas Vaccines for Children healthcare providers in our community. So not only do we provide vaccines through that program in the community, but there are 13 other providers in Hunt County that also get those vaccines. They don't get the grant that we get, but they do get the vaccines. And so we are tasked with overseeing their management of their vaccines. Okay. So this includes monitoring their inventory, ensuring proper storage and handling, maintaining accurate documentation and providing guidance to providers on vaccine protocols, and expanding the RN staff will strengthen our capacity to manage these responsibilities effectively, supporting both public health compliance and the safe delivery of immunization services throughout Hunt County. And as a side note, I wanted to let y'all know that we did have both a financial and a policy and procedures audit this summer with DSHS, which we passed with flying colors on both. And in fact, the site reviewer wanted to commend us because we were so helpful and when they asked for something, we provided it immediately, and we didn't haggle with them over anything. So they were quite impressed with that. So in conclusion, the health department is an essential partner in community health through collaboration with companies and schools. Our clinic expands vaccine access while providing education, guidance, and safe immunization services, resulting in strengthened public health outcomes. So now on to the real reason I'm here. I wanted to just introduce y'all because you haven't been to the clinic. Wanted to introduce you just to our services, and in your packet there, I did include a flyer that one of my previous staff members, designed for public consumption, explaining some of the services that we provide. So our staff consists of 4 positions. We have 1 RN, which is myself, 1 LVN, and 2 medical assistants, one of which is currently vacant and has been since March. Okay. So I'm seeking approval for a change of that vacant position from a medical assistant to that of a registered nursing position. Historically, this was a nursing position, And I made that change from a nurse to a medical assistant as a cost-saving measure to remain within the department's budget for the 2021 fiscal year. At that time, I had came to the clinic as the medical manager, and we had, over the years, we had several other grants that had funded our department, including the TVFC grant. But when I came back, we had lost the tuberculosis program. We had lost, we were in the process, there is what's called an RLSS grant. I don't know the technical name. It's a regional grant that funds the environmental side of the health department, their food inspector. And we were getting a portion of that grant as well, because part of the requirements on that grant we do. And that's the reportable communicable diseases such as salmonella, things that are related to food. But in 2022, we no longer received any of those grants or any of those grant monies from that. So we're continuing to do the work, but not getting any of the funding. So in an effort to offset that, I experimented with changing that position to a medical assistant. And what I found out over the course of time is that it's not an effective way to conduct our business, okay? As the required duties of the health department have expanded, the level of clinical authority and independent judgment needed to safely and effectively perform those duties has also increased. These responsibilities align with the scope of practice of a registered nurse and exceed the allowable scope of practice of a medical assistant. A registered nurse is a licensed healthcare professional authorized to perform independent patient assessments, exercise clinical judgment, administer immunizations and medications, and respond to adverse reactions, provide patient education, and ensure compliance with public health regulations. RNs are accountable for clinical decision-making and may oversee and delegate tasks to other staff while maintaining responsibility for patient outcomes. In contrast, a medical assistant functions in a supportive role and performs tasks only as delegated and under appropriate supervision. Medical assistants are not licensed to independently assess patients, make clinical decisions, develop or modify care plans, or provide clinical oversight. Their scope of practice limits their ability to respond autonomously to complex or evolving clinical situations. So, given the evolving demands of the clinic, including immunization services, communicable disease response, coordination with schools and employers, and increased regulatory requirements, the broader scope of practice of a registered nurse is necessary to meet current and anticipated operational needs. This distinction supports the need for an RN position to ensure patient safety, regulatory compliance, and effective delivery of public health services. Staffing decisions must reflect not only cost considerations, but also the level of clinical authority, flexibility, and accountability required to meet expanding public health responsibilities, while maintaining patient safety and compliance with nursing regulations. Because the position is currently vacant, this is an appropriate and strategic time to make this change. Updating the position classification now allows the department to align staffing with current operational needs without disrupting existing employees. Making the change at this point supports a smooth transition, ensuring compliance with scope of practice requirements, and positions the clinic to meet our evolving responsibilities effectively moving forward. Making this change helps us to maintain appropriate staffing levels, including the addition of a registered nurse ensures that we can continue to meet the requirements of the grant and deliver high-quality care and maximize the effectiveness of the TVFC funded program. Over the past 4 years, our clinical services have expanded to meet the growing needs of the community and to offset the revenue loss from the grants no longer received. In addition, fees for many services have increased, reflecting updated rates and the added value of the expanded clinical offerings. We have expanded the private vaccines that we offer, and we offer record translation from foreign countries. Prior to my coming back, well, prior to FY24, in fact, we translate shot records from immigrants or from people who are from foreign countries. And it takes a lot of time, as you can imagine, as we don't speak Mandarin. And so it takes us a little time to research and be able to do that translation. So in 2024, I instilled a charge for record translation, which was approved by the Commissioners Court at that time. We currently charge $10 to do that translation. And as I said, we also increased the amount that we charge for our private vaccines. We get a lot of travelers, people going on mission trips. Having L3 here helps because they have a lot of staff that travel to foreign countries, and so they come to us for those vaccine needs. So we have increased our revenues over the course of time since I've been here. If this change is approved, the additional registered nurse and I would pursue our hearing and vision screening certifications and certification to perform sports physicals. These expanded services would offset some of the additional costs of the salary difference by enabling the clinic to generate additional billable revenue, increase overall clinic income, and enhance financial sustainability, while also improving access to preventative care for the community. Because the current MA position has been vacant since the beginning of the fiscal year of the TVFC grant, which is the fiscal year for the grant is different from the Hunt County fiscal year. Our fiscal year starts September 1st and runs through August 31st for our grant. So since September 1st, there has been a cost savings in that salary that has been vacant. And that savings would be applied to the salary and fringes of the new nurse for the remainder of FY26. If we hit our projected revenue, then the county won't incur any additional cost for the transition position for the rest of FY26. If this person had started working at the beginning of the fiscal year, it would have cost the county a difference of $24,249. I am proposing that if it is approved, that the nurse would start, I think we said January the 12th, I didn't write it down, I'm sorry. But it would be towards the end of January. If it is approved by you, then we also have to get approval from the TVFC program contract management team to transition that position to a nurse. I don't anticipate that being a problem for them, as they would prefer that there would be more nurses and fewer MAs. So I propose that if you approve transitioning that position to an RN, we would start her out at a salary of $65,000 a year. In conclusion, restoring this position to a registered nurse aligns staffing with the expanded scope and complexity of our clinic services, ensuring compliance with grant requirements, and enhances our ability to provide high-quality care. With the position currently vacant, as I said, this is an ideal opportunity to make the change efficiently, strengthen clinical oversight, and expand billable services and support ongoing public health initiatives such as immunizations, communicable disease management, and school and community partnerships. Approving this change will position the clinic to meet current and future operational needs safely, effectively, and sustainably.
Thank you, Carolyn. Commissioners?
Carolyn, first of all,
Yes.
to you and everyone, forgive me, I have a touch of bronchitis.
Yeah, you need to go see a nurse.
Yes, I need to go see a nurse before I get it. It would have been better. So I understand the advantages that you get by changing it to an RN, and as one from service and from revenue growth. And so that's a plus. I'm just curious, when you eliminate the medical assistant position, are there now tasks that you don't have the staff to perform that individual would have been doing that an RN would not do?
No, sir. We still have another MA, which is why it's kind of having two MAs is kind of redundant because we have fewer MA responsibilities and more nursing responsibilities. So over time, by making that a medical assistant position in the first place, and we have continued to have more and more requirements due to the grant that require a nurse. That MA job, what she is able to do has shrunk, and it has put more responsibility on myself and my other nurse, which is why I wanted that position to be changed back to a nurse to help alleviate that strain on the two nurses. And that way the MA that we have left can continue on with the duties that she performs.
So short of some significant growth and activity, you don't anticipate that sometime in the near future you're going to need to add an MA after you do this?
Not anytime soon. As Hunt County grows, as you know, it is growing, and as it grows, I don't see even then a need for another MA, but rather potentially another nurse in the future. I started working initially for the Hunt County Health Department in 2012. And at that period of time, we had 10 nurses. And only 2, not even MAs, they were just strictly clerical personnel. And over the years, due to the increased cost of personnel and the decrease in funds from the grants, as someone would leave, we wouldn't fill that position. And so we have shrunk due to attrition over the course of 13 years to a staff of just 2 nurses and 2 MAs.
Commissioners, I think that it'd be appropriate that, y'all go out and look at the clinic if you haven't been there. And the problem, this is a need for the community, I believe in it, but it's shrunk from having a pretty good size operation down into a small office building now of 600-800 square
That's
feet.
about-
It's not very big. And it's a bigger project and a bigger program than what we're talking about today. So I would like for y'all, I wanted Carolyn to come tell y'all about it, because I know some of you don't know anything about it, and the community doesn't know that much about it. But there's a need there that as it shrunk because of funding, that was back 12 years ago probably, or plus, and when they started shrinking it. and it just kept going down and down, trying to make it work with the money we had. Our finances have changed as such that I think we ought to take a hard look at it now and see if we're in a position where we can do better than what we're doing. And I don't think that's an answer for today. I think that needs to be all the commissioners go out there and talk to Carolyn and look at the facilities and us have some more discussions about it. Because I'm thinking we need to do maybe more than, we need a new location. I've talked about that for several years. We need another location. We need to do better on a lot of this, not just that position. But we need to make that position, in the near future, make a decision with that while we're working on the other. Is that okay with y'all, or everybody all right? Anybody got any other questions for now, or?
In that additional spot, or is it just, you just asking for an additional 25,000 to increase the salary, basically from 40,000 up to 65,000?
Correct, yeah. And actually, it was 44,000 and some odd dollars for the MA currently. And most of that position is paid through the immunization grant, whether it's an MA position or a nursing position. The position itself will be paid primarily through the grant. It's the fringes, it's the health insurance and so forth. Those are the cost primarily for the increase. And by changing it to an RN position, not for FY26, because it would all be covered underneath the grant. There would be no cost to Hunt County through the grant, because the saved salary that we haven't used so far would be applied to her salary.
But it would affect us in next year's budget.
Yes,
Yeah.
yeah. So, but yes, effectively, it would be roughly $25,000.
Okay.
Yeah. I did want to point out to you, I included in your packet, the Hunt County is in a very unique position as a health department. DSHS, we are located in a region 2-3 of DSHS. And it is comprised of 49 counties. So Region 2-3 only has 12 local health departments, including Hunt County. And Hunt County is bordered by 8 other counties, as y'all know, and only one of those counties has a health department. So we service all the counties that are around us as well. And so I gave you a graph that shows the counties that we have served just this year in 2025. And you can see that there were many counties that we saw. Some of them didn't even touch our county. Some of them came from Collin County, Rockwall. Collin County was the greatest number. But we even saw people from Dallas County.
And they have a health department.
Just curious, is there a reason?
There are some very varying factors there. Maybe it was a student that needed to get into school and they couldn't get into the Dallas County Health Department in a reasonable amount of time. And so they were able to come to our clinic. Maybe they are a traveler. So one of the things that we offer is yellow fever vaccine. And there are only so many providers in the state of Texas that have the license to administer yellow fever, to purchase and administer it. We happen to be one of them. So there could be just very different, varying reasons. We've even seen people from Wood County, a few. And we even saw one from Oklahoma during back to school. So
We got to draw a line somewhere.
you have to draw a line.
During COVID, nearly every adjacent county's judge told me they were going to get a health department because we had a lot better situation here because we had a health department during COVID. And of course, none of them have done it, but they saw the importance of it during COVID. It was extremely important that we had the health clinic.
It is very important. And the measles investigations is one of those examples, current examples, because we are a local health department, we get contacted immediately from providers when they're testing, whether it was through the ER or through their medical provider. We would get notified immediately. God help me, I get calls at midnight from providers, hospitals, ERs, when it's a communicable disease that has to be reported immediately. And so I get calls in the middle of the night. I get calls when I'm on vacation. Another reason why this is an example of why I'm asking for an RN. If I go on vacation, I have to take my cell phone with me all the time because nobody else in the office is qualified to answer those midnight calls. So I have to take it everywhere I go. And trust me, they always call when you're on vacation or on Friday evening when you're fixing to go out to dinner. And so if I had another RN, I could leave that phone with them and I could enjoy my vacation. Okay, because no one else in the office is qualified to answer those calls and to provide that guidance and to contact that patient and make those judgment calls. Okay.
Well, I do appreciate, I believe the term you used earlier was experiment. I do appreciate in 2021, you were willing to try and see if there was a way to reduce costs, because that's what we're asking everybody to do right now is try. But I respect the fact that you come back now 4 years later and say, we gave something a shot, it didn't work, because I do respect that you gave it a shot and you recognize when it didn't. Thank you for that.
Thank you.
All right, we got a lot on the agenda. Let's put this to the side, and I'd really like for y'all to all go out and look at the clinic, and let's have a bigger discussion in a future date, in the near future date. Thank you, Carolyn.
Thank you, Judge. And thank y'all, and Merry Christmas.
You too. Action item number 4, presentation update on transportation by the Hunt County Steering Committee. D. Hilton. Yeah.
Have the report there. Can you put up the...
Mary? You just wanted to pass it down to them.
Morning, Judge and Commissioners. Thank you for having me today. I'll try not to take as long as I could to talk about transportation. This is about a little over a $500 million issue for Hunt County, but I thought it might be good to have a bit of an update. Since 2010, we have worked to develop a plan for Hunt County. Hunt County is one of the few counties in this area that actually has a transportation plan. That was adopted by this court in 2013, endorsed by all the cities in Hunt County, and then the steering committee went about trying to put together a bond issue to give feet to the plan that was put together in conjunction with the North Central Texas Council of Governments. So we did that, had a bond election in 2016. In November, it passed almost 2-to-1. $24.2 million was authorized by the citizens, the voters, for use in planning, design, and engineering of on-system roads, highways. And the reason we did that was to leverage, get leverage so that we would get construction dollars from state and federal sources. And so that's what we've been about since 2016. Freese and Nichols was engaged about that, well, actually before the bond election, they helped in putting together what we did during the bond election, and then they have worked for the county, been engaged by the court since then as the engineers to carry out the various projects. So one of the things we did during the bond issue, the lead up to that, we made a lot of presentations around the county. We told people that if it passed, we would come back and make additional presentations and give updates. And what you see before you, this is an update that we do every 2 years. And it kind of gives a thumbnail sketch about what's going on. We change the cover each year, or each time we print it to give a little bit of a view of what's happening. These are 4 of the projects that are ongoing now. The upper left is the Highway 24 in Commerce, and then you have 2642, which is the Farm to Market Road that goes by Royce City High School and Buc-ee's, that's under construction. And then you see 2 shots of the interstate, the one on the left being 1570, the one on the right, 1903. Interchanges on the interstate, but those are also places where Hunt County is working on engineering to change the profile and the capacity of 1570, and then later 1903 and 36 going into Caddo Mills. So those are very important projects to us. But what I was going to do is just go through as briefly as I can the PowerPoint presentation that we have updated at about the same time we published the biennial report. And this is a presentation that I make to service clubs or garden clubs or whoever will invite me to come and talk about transportation. And I really thought I would have a lot more since all the work was going on I-30, and people are kind of inconvenienced from time to time when they have to travel on I-30, but not too many. So this is the steering committee. The steering committee was set up by Judge Horn, Judge Stovall's predecessor, in 2016, and primarily is made up of city managers, 5 city managers within the county, a representative of L3 and other businesses in Greenville, and also some economic development folks that we set that up at that time so we'd have continuity. And this court has totally changed since 2016. In fact, less time than that. And so the whole idea was to have continuity, because unfortunately transportation projects take forever. And many of the projects that are ongoing now have been in the planning stages for 10 years. And so that's not unusual at all. So continuity is one thing that's needed, because this committee reports to and is put in place by the county judge. We make recommendations to the county judge, and then he then decides whether he wants to forward that recommendation to the court. This is just a map of where all the projects are in Hunt County, and Commissioner Monroe, you've got most of them in your area, because that's where the growth is. And the Commerce project has been completed, and there are others that we'd like to do, but it's difficult to recommend issuing another tranche of bonds to fund a project that might not get built for 15 years. And so we're looking at that very, very carefully. But this shows you where the projects are in Hunt County. This gives you a list of the projects. 276 in Quinlan was completed. 24 in Commerce was completed. 2642 at Royce City High School and Buc-ee's is underway, and that'll be 5 lanes with curb and gutter, sidewalks on either side. I-30 from Royce City to Greenville is under construction. Now, that's totally a TxDOT project. They've done the engineering, planning, and construction along with federal dollars to implement the construction, but that's basically from 2642 to Monty Stratton. 1570 from State Highway 66 to I-30 and then on to 34. That project is 95% engineered and just waiting for time to pass for right-of-way, small amount of right-of-way to be acquired, and then that project will let in 2029. Unfortunately, it was moved back 2 years with some state funding issues that have taken place in this biennium. 1903 is 36 is from I-30 up to Caddo Mills High School, and that project is about 60% engineered and is almost ready for a public input session that'll take place probably in the first quarter of next year. We're doing some work in Caddo Mills. They've got a problem with State Highway 66 at 36, and it backs up. That's where the signal light is there, and we're trying to, TxDOT's going to, in the first quarter of next year, going to add a couple of right turn lanes and a left turn lane on 66 to try to alleviate some of that buildup of traffic. And this just shows you I-30. This is from Royce City to Greenville, and this is where the work is taking place. You can see when construction began, when it's supposed to end in 2027. And then once the overpasses are all 6-lane, then travel lanes will be built to increase the number of travel lanes to 6. Unfortunately, that project got moved back 2 years. The overpasses are underway. That will be done based on that schedule. 2027, the plan was to let the additional travel lanes in 2027 so that those would be done immediately after completion of the interchanges, but that's been moved back 2 years because of the funding issues that TxDOT has. This just gives you a little more detail of some of the sections on 30. These are some of the interchanges. This one is 1570. And Daniel, stand up and point there. See that little hook down at the bottom? Go up a little bit. No, on the other side. There you go, there. That was the existing route of 1570. It's now being moved about 300 yards to the northeast so that you don't have the offset at that interchange. You can also see the costs involved. These interchange projects, and there are 6 of them, started out, the ones that were complete rebuilds of those started out between 20 and 25 million as the estimate. And you can see there that the one at 1570's let for 67 million. The one at 36 is 81 million. The new interchange at County Road 2511 is 62 million. So you can see what inflation has done in the area of construction. And then you see that the unfunded amount, about a third of the widening project, still needs some additional funding, and that will grow by the time it gets let. But that will get done. This just shows you the difference in the profile. The upper profile is existing. With 2 travel lanes, 12-foot travel lanes on either side, and only about 4 feet of shoulder on the inside. And then you see down below, you've got 3 12-foot travel lanes, and you've got 10-foot shoulders on either side. So I think that'll make a lot of people more comfortable driving on the interstate with those barriers, because sometimes people feel a little bit challenged to stay between an 18-wheeler and the barrier as they're in the left-hand lane. This is 1570. As I mentioned before, it's taking away the offset when you're going from south to north, if you're going through on 1570. So that lines up. And from both directions, it'll have U-turn lanes, which will increase the traffic flow considerably. This is 1903. The same thing there. It's being moved slightly to the west from where it was originally, which takes away the small offset. So if you were going north on 1903, you'd come under and you'd be looking right at the fireworks stand, and now it's going to be a straight shot going up 1903. Closures. 1570 will be reopened in September 2026. At least that's the plan for now. 1903 will not be closed until after 1570 is reopened. And they don't anticipate prolonged closures for either 36 or 1565. Kind of the question of what happens next. TxDOT already has some planning ongoing from Monty Stratton to Hopkins County, and that will be done probably in three projects, could be four, depending on the sizes. TxDOT's challenge really is finding enough contractors that can do larger projects, and they're challenged statewide, and so they tend to look at dividing these into smaller projects to make them more manageable. But it'll be the same profile basically as what's going in now between Roy City and Greenville. This is 2642. You can see the work that's being done if you've gone over there and taken a look at it. That's in the upper left-hand corner. That's Roy City High School in the parking lot there by the stadium. Bucky's parking lot is on the right, so it kind of gives you a little bit of a perspective as to where the picture was made. That's about a $35 million project, and will complete probably toward the end of next year with the absolute cleanup by the January of 27. This is the 1570 project. 1570 from 30 to 34 is the most heavily used farm to market road in Hunt County. And so this project is about 95% engineered. There's some right-of-way that still has to be acquired. A lot of the utility relocation planning is complete, and so it just has to be let. And again, it's been moved back to September of 2029. It's about an $80 million project, and TxDOT anticipates that they probably will divide it into two projects to attract more bidders. If you have smaller projects, probably have more local type bidders for that. But you can see the overpass there it's being built at 1570. That shows you the profile. It'll be two travel lanes on each side of a left turn lane in the center, so it's 5 lanes with this one's going to have 8-foot shared use paths for pedestrians and bicycles, and will be curb and gutter. So it's an urban profile for that area, which will, I'm sure, develop with a lot of residential and maybe light commercial. This project is one that we've worked a lot on, and the judge and I have had conversations with North Central Texas Council of Governments on this, because it truly is a regional corridor project that goes from State Highway 78 and will go all the way to I-30, and it's a great reliever project to get traffic through Nevada, Josephine, Caddo Mills, and on to the interstate. The first phase of it that will be completed is the green on the right, and that's the project from I-30 up to Caddo Mills High School. And then instead of going through Caddo Mills on 36, it's projected to veer to the west to connect with FM6. That then goes to the Hunt County part, will then go to the Collin County line. The Dallas TxDOT district is working on FM6 in Collin County, and so hopefully those will meet. The blue that you see there, that's a major project, because it has about a 1,400-foot bridge that goes through a low-lying area, and then it'll have a kind of a double overpass to go over the railroad and over State Highway 66. And so that's a major project. TxDOT asked to take over that project, basically from Caddo Mills High School to the Collin County line. I think we were somewhat reluctant to do that. It saves Hunt County a lot of engineering money and design money, but it makes it a little more difficult for us to be the squeaky wheel and try to push it really hard because once the 1903 and 36 are done from the interstate to Caddo Mills High School, that'll be 5 lanes with 12-foot sidewalks, shared use pass on either side, curb and gutter, and that'll have a tremendous amount of capacity to get to Caddo Mills High School. But then it hits the city streets of Caddo Mills, of Gilmer Street, and the others there that can't handle that kind of traffic. And so it's going to be a great project, but the real value in that project is going to come when it's built out all the way to Josephine. You can see a better view of what the first part of it is the part kind of through the middle of the slide there. That's up to the high school. And this is the Commerce project that was completed in 24, and this is looking at the building on the right. This is looking north. The building on the right is the visitor center, and you can see a little bit of the football stadium up there at the top right. But that's looking at the new interchange at University, and the Commerce project was really done to try to. It is more of a safety project than anything else, because that was a wide open, had bar ditches, rural profile, and now it's curb and gutter, and the whole idea was to try to slow traffic. And so there are 3 signal lights, one at Culver, one at University, and then up at the top there is one at Live Oak. And so that will slow traffic, plus there's a hawk system to stop traffic for students and others going from the east campus to the west campus. And so that's still, we still have some work to do on State Highway 11, which is Culver, and we have a plan for that, but we're waiting on the university to complete some planning that they're supposed to be doing for university property to give better access to the new arena and the Ag Expo Center that are south the high-rise dormitory. So that works ongoing, waiting on the university for that. And this is 276 at Quinlan, which was completed in 2023, and that's really a nice addition to take 276 and tie it into 276. It goes to West Tawakoni and avoid downtown Quinlan. So that was completed. Seems like a bargain at $22 million. There's nothing anywhere close to that anymore, unfortunately. This is a time schedule, and I'm not going to go through that. It's in your book. It keeps changing some, but we just like to give people some idea of how these projects work out, because you got to go through design and the planning and then the engineering before you get to the construction, and so it's a pretty integral schedule there that is being managed. This talks about the federal funding. I guess the thing I'd call your attention to is the fact that we now have $574 million in committed funds that either are let contracts or funds committed for 1570 and some of the other projects. And to date, we've only spent less than $10 million of county funds, and so that will grow as these projects are completed. But the leverage is about 47-1. Now that's not going to continue. I think we told the taxpayers it'd probably be 6 to 1 or 7 to 1, something like that, which is pretty good leverage. But with the I-30 project, that has helped the leverage considerably. And quite frankly, the I-30 project in Hunt County is being done quicker than it probably would have had the Hunt County voters not approved the bond package in 2016, because the Hunt County portion from Royce City to Greenville is being done really simultaneously with the projects in Rockwall County, and normally those would have been done consecutively instead of at the same time. So I think we're getting a little bit of a bang for our buck, and timing wise to get those done more quickly. But and I'm going to talk a little bit more about in just a minute the costs involved. That just gives you a different background of what the federal funds, state funds, Hunt County funds that have been used for those particular projects, including the interstate project. I always try to talk about our partners, because Hunt County is partnered with TxDOT and the North Central Texas Council of Government and the Transportation Commission, and that's really important to have those partnerships. And we spend a good bit of time trying to keep those both viable and good communications, and to keep pushing our projects forward. The other thing that I just want to mention, and it's really normally a surprise to people, voters, is that Hunt County has a thoroughfare plan that was adopted in 2022 and paid for by the bond dollars, and there it is. And that's the plan that you have in place that allows you to require the retention of right-of-way as new developments are done, so that where you have an existing 30 or 40 foot right-of-way, and this plan says that someday you're going to need 100-foot right-of-way, you know how to plan and how to allow platting to be done to make sure that when more right-of-way is needed, you're not buying a bunch of houses and things that are already built. You've got good setbacks, and most counties don't have this. Most rural counties do not have this, and with state law not providing zoning and some of the other things that cities have for counties. It's really very important to have that. So that was a good a good expenditure of county funds to do that. So that just gives you a little better idea of how it stacks up. And it has detail on it. I mean, it even has interchanges along 380, for instance. So when that develops to be a much wider, bigger road, it'll allow for more capacity. So, okay, the other thing I wanted to do was to, I think you have, hopefully in your packets, a couple of pages that talk about the bonds, and if you look at that, you can see the net proceeds from the bonds. The commissioners' courts have voted in the past to issue two $6 million tranches of bonds, and so those were done at 2017 and 2022, I believe, and the and with the bond premiums, that's resulted in a little over $12 million being brought in, and then the earnings on those funds as they've been invested before being spent on primarily on the engineering of these projects has brought in another $868,000 over that period of time. So the net funds available, or the gross funds available, is a little over $13 million. And to date, $10.9 million has been committed to the engineering side, authorized for engineering. Of that, only about 9.4 has actually been spent, and then there's some other expenses that have taken place. So the net is that you've got about 1.9 million of unencumbered funds that are available from the issuance of the bonds and the interest earnings, and and I think the last authorization was done about 2 years ago. There have been some changes as TxDOT has looked at some of the plans for 1570 and 1903. There have been some additional things that they've required. They've had us go from 8-foot sidewalks to 12-foot sidewalks. They've changed some of the drainage requirements and some of the right-of-way requirements, and so there's a need for an amendment to the work authorizations. Do you all have this in your packets?
Jess, did you get them in? Did you see that?
Do they have this? Oh. Okay.
I already have their package passed out.
Okay. Well, there's about there's a total of about $281,000 in additional costs that the committee has recommended to Judge Stovall be amended to these projects that are ongoing. One of the projects is the FM 36 in 1903 project, which has a net increase of about $138,000. There's some adjustments. We had some things that Freese and Nichols is not going to be doing, and then there's this additional work that needs to be done based on TxDOT requirements, and then on 1570 there's about $132,000 in additional work. Some of it's environmental, some of it's hydrology, some of it is right-of-way, changing the right-of-way profiles, and then there's about $10,340 in program management from which will cover about 2 years, and it provides for Freeze and Nichols basically to do the work to help the committee and answer questions of the court and others, and work on things like the biennial report. So our recommendation to Judge Stovall was that these amendments, there are 3 amendments that would need to be approved, total $281,811, that those be approved. I don't know if you want to pass this out or.
Probably what we're going to do is put it off to the next meeting or call a
Okay.
special session to do it, because
Okay.
with their new rules of posting, we had to post this before our meeting last week, and so
Okay.
we didn't quite get it all on here the way it needs to be. So
Okay.
we'll put it on the next agenda, or if Freeze and Nichols needs it, we'll call a special session and get it done.
No, I don't think you need to do that.
Okay.
Yeah. No,
Is that all right,
that's-
Commissioners? Y'all need to look at that and see it.
Yeah, I think that's fine. The only question, so that's with that money actually comes out of the 1 point whatever million underrun that you currently
Yeah,
got?
the 1.9 million well, those are unencumbered funds.
Yeah.
So that's money, it's about $1 million plus the interest earnings that you have there. It's about $1 million that had not been committed for any expenditure of the bond funds, and then about $870,000 in interest earnings to date.
Yeah.
So that will continue. So,
All right.
any other
Any
questions?
other questions? Thank you, Dee. I tell you, he deserves something, a round of applause or something. He's been doing this for 15 years for free, and he's done a tremendous job for the community, and just can't say enough thank yous, Dee. We appreciate everything you do.
Wasn't it last year he was recognized by the governor for
Yes.
working this as well?
Yeah. One of the few citizens ever to get the Road Hand Award by the Texas Department of Transportation. So, thank you, Dee.
Should be the squeaky wheel award.
Close enough. All right, action number 5, extension of term for Hunt County Sheriff's Office School Resource Officer agreements with school districts, Bowles, Campbell, and Wolf City. Commissioner, Sheriff, you got anything you want to say, or? Any questions? Entertain a motion for approval.
So moved.
Second.
Got a motion second. All in favor say aye. Aye. All opposed? Motion carries. Action item number 6, discuss and possibly take action on a 5-year renewal with the Greenville Driver's License Office. Commissioner, I think we're going to put this off. We have plenty of time on it, but it's up for, if y'all remember, or the ones that were, I guess Steve's the only one that's been on the court. Driver's license left several years ago, and we didn't have a driver's license office. We got them back into it with a 5-year lease. They had to pay for the improvements, $470,000, and then we lease it to them at a very favorable rate. So that time is up, so we just need to take another look at it. We got several months to do that, so we'll put it off to the next meeting. Our time's running kind of short. Got a late start. Action number 7, congressional redistricting map, adoption and precinct line boundaries amendments related to House Bill 4 from second special session of the 89th legislature, signed by the governor on August 29, 2025, also referenced as Plan C2333, period. Daniel.
All right, these next 3 items go together. They're all interrelated. And the 2 maps, or sets of maps that I handed out earlier, these were put together by our outside counsel, Allison Bass, down in Austin. They're the ones that did the county's redistricting related to the 4 precincts that you represent when the new census came out 5 years ago. As I'm sure you all know, the legislature adopted a new map in the last session that was in litigation up until a couple of weeks ago. The Supreme Court, U.S. Supreme Court, ruled that Texas did have the authority to do that, and it wasn't illegal in the way that it was adopted. So, the impact of that is that the southern half, or the southern portion of Hunt County was put into a new district in that map. And so instead of having one U.S. House rep for Hunt County, we'll have two. The legal impact of that is important because if a county is split in half, then voter precincts in that county have to be divided up in the same way because of the requirement that you not vote, or that one precinct not vote for more than one congressional race. And so what's in front of you are two different sets of maps. The one on the top that I think it's 5 pages, it says at the bottom just Hunt County in white. That is for item number 8. And then item number 9 is the second set of maps. That's the one related to JP precincts. Item number 7 was put on there before we had our outside counsel look at this and get back to us with the maps. The Commissioners Court doesn't actually need to do anything to adopt that new map that the legislature put together. That's automatic. What we need to do now is to adopt these new maps that are related to that. And so on this first one, number 8, the new maps are in that lighter colored copy. If you switch, I think turn back to the last 2 or 3 pages there, it gives you kind of the overview of those, of the new way that those precincts are laid out. This will, if you approve these maps today, Jeannie has put together a publication that would go to the newspaper later today to be an official publication and notice of those new precincts. It necessarily will change some of the voters in that area where they end up voting potentially because of the different layout of the precincts. So Jeannie is here and can answer any questions that you have about those precincts and the general planning for the voting there. But back to what I was saying at the beginning, this is just a necessary part of the process because of the new map that the legislature adopted. And item number 8 is not related to the JP precinct change. That'll be item number 9.
So which one has the JP precinct on?
It's the one with the colorful map up front. It's a 4-page packet.
Got
that
it.
was right behind that. And I've got copies on my computer if you want to blow them up on the screen. I've put them in a PDF and a PowerPoint just in case we want to blow them up on the screen and zoom in to anything if you have questions about that.
All this is affecting is the voter precincts, correct?
This item number 8, that is correct.
Right.
So 7 is the congressional map that the state approved. 8 is us creating those new voting districts for that?
That's correct.
Okay.
How are voters advised of the change? Sorry, Jeannie.
That's okay.
Secretary of State will send them a new,
Actually, the county office is responsible for sending out the voter certificates. Fortunately, that will go.
Hey, Jeannie, can you come up to the mic because people online can't hear unless you talk in.
My office is actually responsible for sending out the voter certificates. That's what they call them. They're actually the voter registration cards that are different colors. This particular redistricting and notification to the voters is going to coincide with what we call mass mail. Every 2 years, their voter registration certificates, your voter registration certificates, they expire in December. So what we're trying to do is coincide. It'll all go out once as opposed to sending 2 cards to the different voters. It is worth noting that just for the public's sake, we have maintained, this is speaking back to me, we have maintained the voter precinct numbers despite the congressional redistricting. So what it did was to split voter precinct 319, basically. It's got a northern half and a southern half. The southern half is going to stay 319, and the northern half is going to be moved up into precinct 318. Those voters will now be voting at Prairie Valley Baptist Church. And then there was a little section of precinct 323. They will now be voting at Fletcher Warren, I believe, at 325.
Thank you.
All right. Any other questions? All right, so no vote on 7, or do we go?
No vote on 7.
No vote on 7. Can we vote 8, 9 together?
No, those have to be separate because
Separately?
they're,
Okay.
yes.
All right, entertain a motion to approve action item number 8.
Motion.
Second.
Got a motion second. All in favor say aye.
Aye.
All opposed? Motion carries. Entertain a motion to approve action item number 9.
Motion to approve.
Second.
Got a motion second. All in favor say aye.
Aye.
All opposed? Motion carries. Action item 10, discuss and possibly take action on the joint resolution and statistical information for the joint primary elections to be held on Tuesday, March 3rd, 2026.
I'm back. This is just a procedural joint resolution for the county to enter into a contract with the Republican and Democratic parties.
Okay. Any questions? Entertain a motion for approval.
So move.
Second.
Motion second. All in favor say aye.
Aye.
All opposed? Motion carries. Action item number 11, Volunteer Fire Department VFD's proposed ESD, South Hunt County, presentation and discussion regarding the possible creation of emergency service district to support fire protection and emergency services in the southern portion of Hunt County, including proposed area boundary services and next steps. Gary?
Thank you, Judge. Also, thank you for all the first responders that are here today. I know this is important to all of you. So last Friday, we can hold up. I'm not going to do this unless it's necessary. This was presented in an open meeting. We reviewed it as a workshop, so we were not going to take a vote. That way, I had time to disseminate. But did a presentation that allowed the conversation to take place about where we're at. There's been several changes in the last year in our volunteer fire departments, especially as they affect Precinct 2 and Precinct 3. And we had conversations around what those were, everything that really associated with improving future enhancements to the fire services through ESDs. They went even into the county side on impacts to the county budget, what benefits would be there. And that conversation went around, and like you say, you can see that all online in on YouTube to see what all the discussion was. And so what I wanted to do was bring that back to everybody's remembrance from, I guess that was just Friday, so hopefully it's still there and fresh. And bring back to the court, I know there's already been public statements that have been made. Is there any other conversation that we need to have after we've had some time to marinate on this?
Questions, Commissioners?
My questions got answered Friday. I'm good.
So, Daniel, do we have to take any action today as far as the creation of the ESD? We just approve it when they bring it back in for their final plan? What's the procedures?
Yes, that's correct. There wouldn't be any action taken by this court until an application has been filed with a petition.
Okay. So
Um,
do we really need just to show of support, or?
Well, I think it's certainly a show of support for the ESD as we look at the entire,
Right.
but I think there's an actions that were referenced during public statements around the Quinlan Fire Department is identifying what the ESD will need, to my understanding, is the geography and the footprint of which the voters that would be affected would be included, and they would also need that for property values to determine their path forward for budgets. And so taking action to that next step now would just be the logical next step to solidify what that footprint looks like, of which unfortunately, that was where the conversation around the Quinlan Volunteer Fire Department came in.
So with the Quinlan Volunteer Fire Department, are we not taking any action until after they turn in the ESD application for us to approve?
No, so the intent was to go ahead and take that action now at the rate of $60,000 a year with the overhead conversations we keep talking about. That would be an opportunity to reduce cost because we have redundancy with two volunteer fire departments within basically a block of each other.
Well, I don't think we can vote on that today. It's not on the agenda that way. Is it, Daniel?
No, that particular thing is not on the agenda. It basically says, this is under item 11, VFDs, and then proposed ESD presentation and discussion on those things that you just mentioned. But it's not on there for take action on that. That can be added to the next, to the January 13th meeting, though.
Okay. Yeah, I think this ended up just being a copy and paste from Friday.
Yeah.
Probably
Yeah, I
is
think
what
so.
happened then.
Yeah.
So since
Well,
it's
we had
not,
to file it on, again, with the new rules, we have to follow so far ahead of time for a meeting. We had to post it on Wednesday, and then we had our meeting on Friday. So there was no other way to do it except just continue what we were doing. Same thing that happened with the transportation. We had to post it now 3 full business days before.
okay.
All right, so is there anything else we need to discuss about this today then? You want to go?
What about us calling a special session, because we've got everybody on hold for another.
We can, I mean, we can do that. We can vote on it in
you
a
can call
special session. Yeah,
You just have, it's subject to the same rules of basically a 5-day time period, 5 business day time period. Number 1 day is posting, then 3 business days elapse in between, and then on the 5th business day, that's when you can have the actual meeting, unless it's an emergency.
So with the holidays, it's still probably going to end up being, because you can't count holidays,
No, you can't. It has to be business days.
so it has to be, so it's going to be the first week of January.
It's going to be the 5th, 6th, something like that.
Probably we could post it next Monday.
You post it today, and.
Okay, and then do it for either the 4th or the 5th, or 6th, what is it?
Whatever the first
5th
Monday
and
is.
6th is Monday, Tuesday.
At pleasure of the court, that's fine with me, whatever y'all want to
Sooner
do.
the better.
Yeah, because I
Think
think as far
special
as the
session.
immediate
what?
actions,
I would say do a special session, because we'll keep kicking the can down the road.
On-
And
on
there's A lot
Monday?
of things
Trying
that
to
are
figure out
weighing
what
on
the
this.
day,
yeah,
what day works best.
What,
Does it matter to
Monday or
y'all?
Tuesday?
I'm good for whatever day y'all got.
yeah, just make it whatever.
Set it for the 5th. Sooner the better.
Okay,
Is that Monday the 5th?
Yes, sir.
Okay.
that's fine.
And I do believe we have from the presentation, we have the core of the actions that we can create the agenda item from,
Okay,
to be specific.
all right. All right, so we'll move on to action item 12, the upgrade of approximately 3,500 feet of County Road 2580 from rock to asphalt in Precinct 2. Money is in escrow.
So moved.
Second.
Got a motion second, all in favor say aye.
Aye.
All opposed? Motion carries. Action item number 13, acknowledge completion of public improvements for Deer Crossing Phase 2 in Precinct 2.
Make a motion.
I gotta read this first, the way Daniel's got it written. Let's see which one, 'cause I got three of them. Okay. I move that Commissioners Court approve an acknowledgement of completion of public improvements for Deer Crossing Phase 2 and accept roads into that subdivision into county inventory, subject to the following conditions. Completion of final inspection under subdivision regulation 6.05.b, county insurance of letter of public improvement compliance under section 6.05.c, and county auditor and treasurer receipt of a warranty bond compliant with the terms of subdivision regulations section 6.06. Make that a motion to approve.
Second.
Got a motion second. Any questions? All in favor say aye.
Aye.
All opposed? Motion carries. Action item number 14, acknowledge completion of public improvements for Tupancari Ranch Estates Phase 2 and Precinct 2.
Okay, I make a motion that the Commissioners Court approve an acknowledgement of completion of public improvements for Tucumcari Ranch Estates Phase 2 and accept roads in that subdivision into county inventory subject to the following conditions. Completion of final inspection under subdivision regulations 6.05.b, and to county issuance of a letter of public improvement compliance under section 6.05.c, and 3, county auditor and treasurer receipt of a warranty bond compliant with the terms of subdivision regulation section 6.06. I'll make that a motion.
Second.
Got a motion second. Any questions? All in favor say aye.
Aye.
All opposed? Motion carries. Action item number 15, acknowledge completion of public improvements for Tupancari Ranch Estates Phase 3 in Precinct 2.
Same thing as, I move that the Commissioners Court approve an acknowledgement of completion of public improvements for Tucumcari Ranch Estates Phase 3 and accept the roads in that subdivision into county inventory, subject to the following conditions. 1, completion of a final inspection under subdivision regulation 6.05.b. 2, county assurance of a letter of public improvement compliance under section 6.05.c. And 3, a county auditor and treasurer receipt of warranty bond compliant with the terms of the subdivision regulation section 6.06. I'll make that a motion.
Second.
Got a motion second. Any questions? All in favor say aye.
Aye.
All opposed? Motion carries. Action item number 16, acceptance of public improvements for Elizabeth Estates Phase 3 and adding Elizabeth Way into the county inventory in Precinct 3, length 1,240.24 feet or 0.234 miles of right-of-way of 50-foot, is it a 50-foot right-of-way?
Yes.
50-foot right-of-way, 24 foot of surface wide asphalt.
Yeah, the Elizabeth Way is being completed. It's completed its 2-year bond period. It is now ready to be accepted into the county inventory.
All right. Need a motion.
Need a motion to accept.
Second.
Got a motion second. All in favor say aye.
Aye.
All opposed? Motion carries. Action item number 17, a variance request for acreage for an additional septic system in Precinct 2. Brian, or who's?
Hey, Rod.
Rodney, which one are you gonna brief us on?
Good afternoon. We received an application for a additional septic system back in November on this piece of property. We took a look at the property, and this property has 4 single-family units there together on this property, and there's only 2.2 acres on this property. And when we looked at that, there's also the additional system was for a 4,500 square foot metal building to be on this property as well. And going by our rules and regulations that we have for the county, there's not enough acreage for this to be added to this property. So we denied the permit based on that.
So the existing home is a fourplex.
That's correct.
It's not four independent.
And it's also 10 bedrooms.
Okay.
And we base a lot of our septic off of bedrooms. But due to that, and because of our county regulations, we denied the permit.
Even though they had previously had one.
The permit that was issued was just for the 4 unit back in like 2001, when there was a lot more acreage there. So the property's been reduced, it'd been split and down to 2.2 acres. So if they were to submit just for that fourplex today, we would most likely deny that as well. But it was existing there, and then later on, they come in and put the metal building in.
So roughly, how many acres are they lacking if they were trying to get the permit?
Well, it was, I know that they need quite a bit for the no-build zone. And, you know, also, like I say, it was a direct violation of the county regulations, you know, that are approved by the TCE approved regulations for the county.
Commissioner Monroe, it's your precinct. You got anything to say?
Yeah, I don't really want to approve it because it's already, we already had more, like the health department's saying, Rodney's saying is, it's already too condensed for the property that we have there. And now we're adding another to it. We can't do anything about what was permitted in 2001. But now, I feel if we okay it now, we're just telling everybody we're the wild, wild west, and there's no use to having any regulations if we're not going to follow the regulations. Huh?
Give us a second, you can. Is there any alternate system that would ever work on this?
Well, I know that, you know, they could apply for the TCEQ to get a general discharge permit. They'll have to go through the state for that.
That's the only other option as far as a
To
system
meet-
that's
Right.
legal?
Right.
Okay.
So, Mr. Ray, I'm curious, if we were to say no today, the fact that they had a previous permit, is that any legal consideration?
What was the previous permit?
The previous permit was for the fourplex.
Yeah.
Just that alone, when there was like 40 acres. So now it's 2.2 acres. And they've added this additional building there.
And the permit, I mean, did the previous permit reference that entire acreage, the other 40 acres?
I'd have to go back and look at the particulars, but this is what's today, and they've added, this building's been added. So there's not enough room here for the new building to meet, and plus it's, like I say, it's a violation of our regulations. With our regulations, it's a one single family system located on 1 acre. So we've already got 4 units now on 2 acres.
This entire property is 2 acres?
Yes, sir, 2.2, I believe.
Yeah, no.
Okay.
It wouldn't.
Okay, thank you, Rodney. You want to speak?
My name's Michael Gross. I'm the owner of the property. I brought with me Daniel. He's the state licensed septic installer.
Okay.
So he actually has a design plan for the system that will fit on the available land that's on the lot. So I think the first issue, and what he was trying to direct you gentlemen at, was that there was, I thought it was a 10-acre property that had the fourplex on it. Not 40, but so somehow they reduced the property down from 10 acres to 2 acres with this same issue. And the response I got from the health department was that because it was only 2 acres now, that if you ever touch that existing system, then there's an issue with it. But we never approached them with the attempt to touch that system. So basically, we were asking for the additional acre, which is free and clear of any obstructions, on the existing system, to add a new code-approved system, which has been designed and approved by the state, meeting their code requirements. The blowback is from the health department of them trying to pigeonhole us into this existing system and what the failed requirements would be on it existing when someone allowed it to be reduced originally. So the big issue is, how are you going to force me into not being able to develop this land, which I'm trying to bring a business into Hunt County, with this available land, and they're trying to force me into an issue with this existing system, which is going nowhere. We're not touching it. We don't plan to touch it, but it's already, they created the problem whenever they reduced this land to begin with. So
you bought it as a 2-acre tract? You weren't the owner of the 10?
Correct.
Okay.
Yep. Yeah, there was a previous owner, and someone allowed him to reduce this land down to where it actually created an issue with his septic code on that property. And so now with the available land that I have that's not part of that system, I'm just trying to get a code-approved system, which has been designed and approved by state code. So,
When did you buy this property?
I bought this property about November 21, I want to say. It's about 4 years ago. And actually, so I bought this property to help some of my employees out with rent, whatever. So the thought process was for me to put a small office. It's 1,200 square foot office, very small. There's actually 2 people that are working out of it now. One of them actually lives in the apartment that's next door. So it's not like we're even trying to overwhelm the oversized system that we would be putting in for the 1,200 square foot office. So it's really just, in my opinion, a large stretch of the situation and them trying to, put the code, beyond its purpose with the existing system, which is already.
Well, don't be criticizing our people.
Sorry.
They're just trying to follow
Yeah,
the
yeah,
law and
I
follow
got
the
you.
rules they've got.
I'm a master plumber. I know all about codes. I get it.
They're just trying to do their job.
Yeah, I understand.
We're here see if there's a way that we can help you.
I got
So,
you. But yeah, and Daniel would be happy to talk about the code and the system that was designed and all that as well.
So is this lot 1 of this subdivision? Is that what this is? Lot 1 of the AEM Development Edition? Okay, so it was platted and approved as a 2-acre lot. Okay, all right. Your plumber do you want him to speak to us, or?
Oh, I'm the plumber. He's the septic guy.
Oh, the septic guy. Okay, sorry.
Sure.
I didn't mean to insult you.
So my name's Daniel Lagrana Septic. I guess, like Mike pointed out, there's somewhere along the way, the property got allowed to be reduced to the standards that y'all have had set, where it's, I guess, an acre per single-family residence. And with that, having the 4 buildings, y'all requiring the 4 acres. The new system that we want to put in doesn't overlap it, doesn't affect it. There's no overlap to it. And like Mike said, it's only 1,200 square feet. It's essentially a bathroom and a half and a couple desks. I don't see any, besides, the written guidelines that y'all have, there's no practical sense to why the system would not work or cause any issues. It really is, it just comes down to the acre thing and that being the problem there. But in terms of the system, I mean, like Mike said, it's a little bit over-designed. Unfortunately, people don't make septic systems less than 500 gallon per days for an aerobic system, but it's way over-engineered for the purpose it's gonna be. Ideally, it would have been nice to be able to just plumb it straight over to the existing system with how little it is, but like Mike pointed out, we can't touch the existing system, because if we do touch the existing system, now it has to meet the current guidelines, in which it would never happen. So he's kind of gotten pigeonholed into a weird spot here, and really we just, I guess there's no apparent reason besides the guidelines where since it has the 4, they say single-family housings, it's all under one roof, it's all under one system. What we're wanting to do, even though technically it's on the same plot of land there, it's completely separate, not tied in. It won't overlap any of it, won't affect any of it. And yeah, I mean, I guess.
Okay. Well, of course, to me, it's, it's kind of putting us in the same position you're accusing us of already being in. I mean, I know it's an open warehouse building now, but next week it could be an office complex with 20 people working in there, and then it's a whole different situation. And we wouldn't even know about it because of the septic system in there. So we have to look at it, and I think what they do is look at it as a worst-case scenario, because just because it's this today doesn't mean it's that way in the future. In county, we don't have any authority to go out there and do occupancy certificates or anything when people move in and out of buildings. We don't have that authority. So we really have to be careful when these systems go in to make sure they're going to be adequate for what could happen too. And so I don't even know, was that fourplex there before the plat or after the plat, or it was there before the plat? Okay. So it was approved with it there, and the septic system was already in it. Commissioners, any other questions?
Question back for Rodney. Rodney, were you saying that if the fourplex came to you today on
Rodney
this,
will need to come up to the mic.
on this particular lot, would you approve it today?
No, sir, not based on the amount of, just the acreage it has now.
Okay. All right. I just want to make sure I heard that correct. Yeah.
Brian, are they in violation of our subdivision rules in any way? They're not, I don't think, are they?
No, they're not in any violation of the subdivision rules. The plat was done in 21 or 22, several years
22.
ago. And that was actually under the old septic order. That was before we had the current septic order approved, I believe. I think it was still in limbo down in Austin at that point.
Okay.
Whenever it was platted, there is a very defined ditch between, on the back line of this lot, separating it from the rest of the plat.
Back line, is the back line parallel to the road, county road, or?
It'd be the east line or the northeast line.
Northeast line, okay.
Opposite of the county road.
Got it.
The system was, when the developer first divided it up, he proved that the system was completely and totally on the 2.5 acres, did not cross the ditch and didn't affect the rest of it. And that's why he was allowed to plat that, because the system was completely, it was a permitted system that was in place, and it was completely and totally on the lot that it serves.
Okay.
So.
All right, commissioners?
I want a motion to deny it. I think we're setting a precedent if we approve it. I mean, I'm trying to be sympathetic, but we've turned down so many other ones in the precinct, and I think if we okay this one, it makes it hard to say no in the future.
So you got a motion to deny?
I make a motion to deny.
I'll second.
All right, got a motion to deny and a second. Any questions? All in favor say aye.
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 All opposed? Motion carries. Action item number 18, the final plat of Chamberlain Addition Precinct 1. Brian?
Pretty simple plat up on, in Precinct 1, meets all subdivision regulations. They got the right-of-way cleared and ready to go.
All right, any questions? Entertain a motion for approval.
Make a motion.
Second.
Got a motion second. All in favor say aye.
Aye.
All opposed? Motion carries. Anything else? We need to go in executive session. Y'all want to take a break and come back after lunch, or you want to be done with it? Stay with it? All right, we need to go, we'll be going in executive session under 551.071, 1 and 2.
Yes.
That cover us on?
For the things listed on the agenda.
Okay. All right, so at this time, we'll be in executive session under 551.071, 1 and 2. Thank y'all. Action item B, approval of payroll and personnel. Entertain a motion.
Make a motion to approve payroll and personnel with the exception of pay increase.
Second.
Got a motion and a second. All in favor say aye.
Aye.
All opposed? Motion carries. Anything else before the court today? Being none, I entertain a motion to adjourn.
So moved.
Second.
Got a motion second. All in favor say aye.
Aye.
All opposed? We're adjourned at 1:12. Thank you, everyone.